to speedtackny.org following the last of these panels, so you can look for those early next week. Any information is current as of the date of this presentation. We are going to have a lot of time for questions, so we do ask you to submit them via the chat throughout. You don't have to wait till the end, and please be sure to send them to all panelists. If you don't see the chat, if you hover over the toolbar on the bottom of your screen, there should be a bubble, and if you click that, you can have the chat come up. And again, at the top, it'll say to, and you can send it to all panelists, any questions that you have. Additionally, since we do have our panelists on camera, if you go to the top of your screen, you can control your layout. So you can just determine how you want to see the slides as well as our panelists today. And at certain points, we'll be taking the slides down. And at that point, we would recommend that you use the grid layout. That way you can just see everyone on the screen as if we were doing an in-person panel. Okay. So just a brief review of what we are doing today. So we are going to start with a brief review of access standards in New York State, as well as some additional information. And then each of the plans is going to do their own presentation to help provide you guys with information on access and communication and coordination. And then we will open it up to questions. So we're going to start with some common questions that we've gotten in, and then we'll open it up to any questions that you guys chat in regarding access, communication, and coordination. So we're lucky today to have plan panelists from 4 plans on, and we, MCTAC, will be moderating. And so we are going to hopefully have a very lively discussion. So please do send in any of your questions around those areas for our plan panelists. All right. Okay. So to start us off, we just want to make sure that everyone is level set with the access and availability standards. So these are required by New York State, so they're required across plans, and so we're just going to do a quick review of those. So for emergency or urgent care, if you have an emergency client walk in, the expectation is that they'll have access immediately upon presentation. If it's urgent care, then it's within 24 hours of the request. And this includes mental health and substance abuse outpatient clinics, as well as ACT, PROS, and OTP. Now, the access and availability standards regarding routine is that for mental health or substance use disorder outpatients, you'll see them within 1 week of the request. If it is a behavioral health specialist, it's within 2 to 4 weeks for most of those specializations, and within 2 weeks for PROS. All right, the last sort of piece of the expectation around clients getting access to providers is that they will be able to reach a provider via phone 24 hours a day, and that if a client has an appointment, they don't sit in your waiting room for longer than an hour waiting to be seen. You can all find more details about the specific access and availability standards in your plan contract, so please refer to those for any questions. You can also submit questions today. Okay, so since this is a webinar around communication and access, we just wanted to remind everyone of the MCTAC Matrix tool. So I am going to share the tool on my screen. All right, so this is our one-stop shop for where you can go to see our matrix. There's a little delay in it coming up on the screen, so just bear with me. Okay, so you can access our matrix from the tools page of our website. You can see it right there. And you can also access it via the direct URL, so matrix.speedtackny.org. So this is our matrix, and again, it's a one-stop resource where it has all of the plans that serve Medicaid managed care in New York State, and you can see contact information for each of those plans. So there's a number of ways you can search. You can see the map here. You can search by a specific county or by a specific plan. If you know that you're looking for a specific plan that you contract with and you want to see all of their contact information, you could hit by a plan. So let's say we're searching by region, and you hit Tug Hill Seaway. So when you go there, you can see all of the plans in that region. And then let's say you contract with Fidelis, you can click Fidelis, and you'll be able to see all of their plan contact information. So there's a number of tabs for different categories across the top, and if you scroll down, you'll be able to see the general contact information, provider relations, etc., all on this page. You can see that, and you can go to any of the other tabs as well to see additional information. And on the matrix, we have all of the plans. So no matter what plan, Medicaid managed care plan you contract with, you can find their information on here, and the plans regularly give us updates, so we regularly update the matrix and keep all this information up to date. I am seeing a few chats looking for this website, so we will send it around when we send around the slides, but just for now, it is matrix.ctacny.org, and you can also find it on our website via the tools page. Okay, so returning to our slides. All right. Okay, we just wanted to do a brief reminder, since we know that is on everyone's mind, telehealth and the state emergency regulations. So we just want to remind all the providers that OMH and OASIS did have a webinar about the New York State behavioral health emergency status on June 25th, and you can find the link there. You can also find it on our website if you go to the calendar, and that sort of talks through the waivers that OMH and OASIS and DOH issued to allow the continuation of telehealth during the continued state of emergency. So telehealth is able to continue in following the provisions that were set up during the pandemic as we're still in the pandemic. So again, that means you can continue to provide telehealth, continue to use the platforms you've been using, the professionals that have been providing those services under those waivers. And when the state has assured everyone that when those waivers end, there will be a period beforehand where they let everyone know about the new regulations as things go forward once we move out of the emergency period. But again, for now, we're still in that emergency period, so those waivers allow a lot of those emergency regulations to continue around telehealth. Okay. And now we are going to turn to our plan panel. And so each of our plan panelists will be presenting a short presentation. So we are going to start with Cheryl from Beacon Health Options.
Thank you so much. It's really nice to be here with all of you today. I'm sure that most of you know who Beacon is, so I won't go into too many details on this slide. But please know that we are here to answer your questions and help in any way possible. Next slide. The first thing that I wanted to talk about, since this was, discussing access and communication with the plans, is for changes and updates to your demographic information for solo and group providers. So that is individual, group providers. You can visit our website and make updates to your demographic information through our portal using your logon information for your particular practice, whether it's a solo or group practice. And please note that Beacon also utilizes information in CAQH. So it's important that if you are registered with CAQH, that you keep that information updated as well. One of the things that I wanted to point out to everybody is that you can certainly update your information through our portal. But if you do that and you don't update it with CAQH and you're registered with CAQH, we do automatic updates or automatic downloads from CAQH. So whatever information is actually on CAQH is what will populate in your provider file on our website. So whenever you're going to make an update, always make sure that you make that update through CAQH as well as our portal. But keep in mind that you don't have to update your information through our portal right away as long as you're doing it through CAQH. Also, just to note that facilities can visit our website and make any changes or updates to demographic data through the portal as well using your facility logon information. But keep in mind there are certain things that you cannot update on the website, such as a service location, because your service location would need to be credentialed for the services that you are rendering at that location. And you must complete a service location addendum when you are adding location for certain services. And also, if you are adding services that you've not previously been contracted for, you would also need to contact your contracting manager so that they can add those or either through an amendment to your existing contract. So certain things you can't change on the website, certain other things you can, such as updating your W-9, et cetera. So next slide. So here are some communication resources. The first thing is our website. You'd be able to find our Beacon Provider Portal, updated information regarding implementations, et cetera. There's billing tools, a provider manual, plan-specific information, clinical resources, et cetera. You can also gain access to our provider portal where you can also submit requests for authorizations. You can submit claims directly through our website, et cetera. We also have our National Provider Service Line that's open Monday through Friday from 8 a.m. to 8 p.m. And you can contact the National Provider Service Line for routine non-urgent items such as claims, checking the status of your credentialing application, change of address, etc. We also have provider relations, and we have two separate provider relations email boxes, one for upstate, one for downstate. And you would use these for escalated issues. For example, if you feel there's a delay in your credentialing related applications or any questions that you have regarding your credentialing that you feel need to be escalated. Also claims related questions. And then just be sure if you're going to send something to the provider relations email boxes that the item really does need to be escalated, and it's just not checking a routine claim item or status of credentialing that you may have just submitted. Also, we have our EDI, so for portal questions or concerns or any issues that you're having logging onto our system, you can contact our EDI help desk. The number is right there for you. And also, if you have any questions regarding claim submission from your clearinghouse to Beacon, you can also contact our EDI department and they will be able to assist you. You can also give that information to your clearinghouse or your biller if they're having any issues as well. We can go to the next slide. And then again, for escalations, I know that was one of the questions that was asked previous to the meeting. And again, I've put this specifically on its own slide so that if you do need to escalate something, please don't hesitate to contact the provider relations department. The best way to contact us is by email. And I know that we don't normally put these email addresses on our webinars. So, you guys are special. So we just wanted to make sure that you had this for any escalations that you feel need to come to provider relations for us to take a look at. And then you can usually expect an answer from us, at least to acknowledge that we received your email within 48 business hours of you submitting that email to us. So don't hesitate to contact us when you do have an escalated issue, but please also make sure that the issue truly does need to be escalated. This is our clinical programming and support slide. And the clinical program takes a holistic approach to supporting members through its exploration of using in-network providers, community supports, and natural supports. We look to meet the member where they are located and support transitions from one setting to another. If the member is not the identified target for engagement, so for example, it could be a family member or home health care provider, health home provider, then we will work directly with the appropriate entity. Our clinical department strives to have collaborative relationships with our health plan partners to ensure that all comorbid medical conditions are being treated simultaneously, with the appropriate case management team taking the lead in engagement and interaction. And the next slide. For access and availability, this actually also goes to some of the other questions that we'll be answering. But for access and availability, we would want you to notify Beacon when you have members on a waiting list. We would want to know how many members are on that waiting list, for which services, and for how long each member would have to wait for those services. If your facility is full for one or more services, you must notify Beacon and advise which services or modalities you are full for. And if your facility is full for all services, you must notify Beacon that you're no longer accepting new patient referrals. We can put you in a practice full status for up to 3 months, at which time you would then need to decide whether or not you're going to be able to accept new patients, or you would most likely be disenrolled from the network if you're not able to accept new patients at that time. So for all of these items above, if your practice is full, some of your modalities are full, please make sure that you contact provider relations. And again, there's the email boxes to contact us regardless of whether you're upstate or downstate. And then for OMH and OASIS licensed facilities, you must have the ability to treat a member in person at a physical location if a member requests it. And in-person versus telehealth should be member driven, with the determination of medical necessity and any social distancing, mask wearing parameters put in place by the provider. If there is current availability to see a member via telehealth, but you're not able to see a member in person, you should really let us know how long of a wait list you have for a member to receive an in-person visit. And so in any cases above, if the wait time exceeds the standards that that Caitlin spoke about earlier, please contact Beacon and we can certainly assist with a referral to an available provider or facility.
And thank you so much, Cheryl.
You're welcome.
All right, so now we will turn it over to Blue Cross Blue Shield of Western New York and our panelist, Mary.
Hi, good afternoon. Thank you everyone for attending today. And thanks to MCTAC for organizing and sort of bringing us all together. We really appreciate it. It's a great opportunity to get information out that we hope you will find helpful. My name is Mary Ferber. I'm a Network Relations Consultant Manager. I'll be reviewing some communication information, and then Allison West, who's our Behavioral Health Program Manager, will talk a little bit about our care management program. So what I wanted to start off with today is to talk a little bit about the name change for Blue Cross and Blue Shield of Western New York. So I don't necessarily have a slide on this, but I did want to mention that Highmark is the new name for Blue Cross and Blue Shield of Western New York. I'd like to point you to the Highmark website, which is www.bcbswny.com. And actually, I will put it in the chat so everyone can see that. So that you can refer to that website to learn a little bit more about the name change from Health Now to Highmark. We've gotten a lot of questions related to the name change of the company. So do know that you can still identify the company as Blue Cross and Blue Shield of Western New York. When Caitlin was displaying the MCTAC website and she did the health plan drop down, you could see that Blue Cross and Blue Shield of Western New York is listed there. So that's the way to find us. But I did feel it was important for you to hear about that. If you have any questions during the session today, of course, or to review the website and want to follow up with some additional questions, I'm available to answer those questions. So this slide here is our it's a snapshot of our website. So you can see the URL there for Blue Cross Blue Shield of Western New York, and this is for the Medicaid and the Child Health Plus program information. As you know, AmeriGroup administers the Child Health Plus and Medicaid managed care programs for Highmark Blue Cross Blue Shield of Western New York. I am an employee of AmeriGroup, so if you've interacted with me, which I'm sure many of you have, you're also familiar with the naming of AmeriGroup. So if you're looking to just find some general contact information, you can find that up on our website. So next slide. So we have a provider quick reference guide. We've chosen to put this guide in our provider manual. The quick reference guide, you can see the URL that's listed on the slide. When you receive the slides, you'll be able to just click that and go right into our provider manual and reference that quick reference guide. There's a lot of phone numbers that are listed there, and there's just a few that I'll point out and go over today and talk about when it's best to contact those numbers. Next slide. So here's the listing. I think that we find that our call center, the provider services, is the best place to contact for information related to, you can see listed there, pre-certification notification, health plan network information, member eligibility, claims information, inquiries, recommendations. It's the place to go if you need to speak with somebody, right there. So our call center is open Monday through Friday. We're open from 8 a.m. to 8 p.m. And folks are there to help to answer questions for you. We do know that the providers will use the call center. We've received, good feedback on our call center. Folks can be really helpful. Sometimes folks say it's, can be a little challenging to, like, if you want to talk to me directly, I'm not going to be found directly at that phone number. So we're providing this general contact information, and you'll see my contact information a little bit later on in the slide. We also have a provider services fax line, or TTY line, which is available for language services. Also, you can get member eligibility information through that line. We do have an EDI hotline. Those folks are helpful in if you're, if you're signing up for EDI services or having some type of EDI issue, your clearinghouse is having a difficult time in connecting with our EDI services, you can contact that line and help to troubleshoot the issue. If you're having difficulty in working, say, with your EDI, that's something that I can help to facilitate. We've had sort of three-way phone conversations with the provider, myself, and the EDI folks to try to work through some of the issues. We found that to be really helpful. So, don't hesitate to reach out. We do have a nursing line, which I think is helpful for members. You as providers might not make use of that, but to let members know that that nursing line is available for questions that they may have. Again, member services is listed at the same line. We do have pharmacy member services, a separate appeals line, and pharmacy prior authorization. All of this information is also available on our website. And so we encourage you to go to the website to learn more information about any one of those particular departments or areas. Next slide. So we wanted to talk a little bit about practice profile updates. Of course, it's important for us to learn about any changes within your practice. And so on our website, you can find a copy of the form, the practice profile form, to fill out to submit to us your profile update. On that form, there is information on where to submit the request. So that request comes into our plan, and we have staff that actually reviews that prior to the submission. the staff will reach out to you, acknowledge that we've received that, and also follow up with any questions that we have related to the form. Those practice profile updates might take different routes depending on the type of update that's necessary. And the length of time too may differ. So for example, if you're having a tax ID change, that change is going to take a little bit more time. Usually we have to do a contract review related to the tax ID change just to make sure that there isn't going to be any type of impact to your contract. But you know, a service address location change, that's a much simpler change and usually takes less time to process. It's really important for us to understand whether there are changes within your practice. For Blue Cross Blue Shield of Western New York, for facility providers, we don't necessarily have a roster of providers attached to your facility. However, if your facility is doing professional billing, it's really important for us to keep that roster up to date. So, you know, I would recommend that, you know, as a provider, you're taking a look at your information at the very least on a quarterly basis. And I know Cheryl talked about the CAQH application and the use of that tool to update information. We would use the information on CAQH for your individual professionals. As a facility, we're not using the CAQH application. So that's really important that your initial credentialing application has the correct information on it and that you're submitting any updates related to your organization and your facility. If you're going to be adding services, let's say you're newly licensed for, I don't know, let's say an HCBS service, CFTSS service, Article 31, 32, maybe opioid treatment program, whatever it happens to be. That's going to require a contract review. And so that's something that you would reach out to me directly for. I'm sure a lot of you have worked with me on that already, but that's really important that we then take a look at that service. We're going to ask you questions like, what NPI are you going to use for billing that service? We want to know the locations. And then we're going to need to take a look at the license, of course, any accreditation related to that service. And it may be that you're going to need to be credentialed. We may need to amend your contract. So something like that takes a little bit more time to work through. But of course, it's really important for us to, you know the program information, know that it's been approved through Medicaid, and then in order to add that to your agreement. So next slide. So the escalation plan. So I think every question that you have that you're thinking of and that you need assistance with is an important question. So I don't think that really sort of the escalation is at all a reflection on how important the question is. Because they're all important questions. You need to know the information. You'd like to know the fastest way to get the information, right? And we want to be able to provide you with the best route and the best folks who can answer the questions for you. So many of the types of questions that you could have answered related to the status of a claim, perhaps the status of a credentialing application. Those kinds of questions can be answered through our Provider Services Center. And you can see the same list that I had on a prior slide. Those are folks that are there that can answer that question. They can work through, evaluate your question. And then if it needs to be escalated, they may do that, send it to Provider Relations. So another way is just to contact me directly. So my information is listed there, both my email and my phone number. Both ways are good ways to get in touch with me. I think email is really helpful because it documents the issue. So if you're going to reach out to me, give me a little bit of information about sort of what the issue is. And that's why when I reach back out to you, I'll have some information for you. Normally when a call or an email comes in, we like to at least reach out to you to say that we've received that within 2 business days of receipt of that. It may very well be, though, that I don't have an answer to your question yet. Some of the questions that end up in escalation are quite complex, and they take a little bit of time to research. And so you can expect then that, we might be scheduling a meeting to talk about that particular issue, or I'll research it and get back to you in whatever time frame I let you know that I'll be responding to your inquiry. So specifically then, to come to provider relations, my role as a behavioral health provider relations individual is to work with you on credentialing, contracting, and then more complex issues. If you're going to be just needing a quick answer on a claim, member eligibility, inquiries, you're going to be going to our call center. They would really be the best place to go for that. Sort of a typical day for me is spending a lot of time on credentialing and contracting and claims, I'll have to say. A lot of inquiries that we get are really related to claim appeals. Something didn't happen correctly on the claims payment, and so we're usually kind of working through and chatting about what's wrong there. We do have an appeals process for claims. You can certainly contact our provider call center to work through the issue related to that claim. We also want to make it convenient for you too to be able to do it online. So you can go to our Availity website and you can call up the status of that claim, and you can file an appeal right there while you're looking at the status of the claim. So if you need some additional information related to working on our Availity website, I think we talked more about that platform on our last panel. I'm happy to help you through that, work through that, and to kind of navigate that. Next slide, please. So on this slide, I'm going to pass it to Allison West, who's our Behavioral Health Program Manager.
Good afternoon, everybody. This is Allison West. I am the Behavioral Health Program Manager for Blue Cross Blue Shield of Western New York, better known as now as Highmark, Blue Cross Blue Shield of Western New York. I think that we added these slides because it's a really important thing for providers and community members to know that our health plan has assigned behavioral health case managers and clinical staff in our utilization management departments to assist with any needs that providers may have to assist our members. Really, our outcomes are member driven and provider driven. We want the best outcomes for everybody. So we've really taken it upon ourselves to make sure that we have the staffing available to help with any of the needs that arise. So as you can see, these are direct bullets from our case management flyer that we do have available if anybody's interested for our Western New York partnership. And it does have a direct line to our case management team. So as you can see, case managers can help you assess the care and services members may need regardless of language needs. Currently, we actually have a lot of our case managers using our language line to help with communication to some of our refugee populations. They help out with the health home case managers and care coordination efforts and assisting them to find services in the community that will work for them and for their language needs and any barriers that they're experiencing. And that's what the next bullet says. Language and special needs are a priority for all of our teams, including our physical health team. I'm talking a lot about behavioral health specific case management team, but on our physical health side too, we have several case managers there who can help out with some of the physical health needs of our members. They do diabetes screenings, medication management, all of the above. So it's not just behavioral health specific. We can care coordinate care coordinate for all of members and provider needs. If there is difficulty with finding resources, if you are a provider for a member, the case management staff can help out with that as well. There is also, Mary, we didn't add in here, but this is something that the providers may, we would want to add after. Providers can also access our Aunt Bertha line, and they can utilize that to find resources and language needs in the community as well. And we've made that available for members and providers to access along with our case management teams. So if you feel that your needs aren't met, if you're having trouble, with access to care, wait lists in the community, or connecting members to the right areas, our case management team and utilization management team is a really good way to go. And a lot of times I think providers get in the door through Mary, which is great, that's fine, but she may end up sending you to one of our teams so we can open up a case and monitor whatever your needs are, whatever the members' needs are at any time. We are available 24/7. That includes our nursing line, and our case management staff are usually available 8 to 5, but even after hours, if there's a need, there is somebody available. So provider waitlists that occur will be documented internally within our case management and utilization management systems. The team will work with members and providers to find alternate options for referral and appointments, should that be a need. We have a full team of outreach care specialists, so if there's difficulty in finding an appointment time, a provider, they will do all the research and the headache lifting for you guys. Let them definitely do that for you so that you can have somebody on our end just looking that up for you. So the CM team will assist with the behavioral health access to appointments for non-life-threatening emergency within 6 hours of the initial request. If an appointment is unavailable, the patient would be redirected to a crisis service if it's appropriate, and they would help assist with that as well. So depending on what type of request it is, this is our turnaround time. If you have a request coming in for a case manager, we attempt to outreach you back within 24 hours of that initial request too, if it's not an emergency. Next slide. And that's it. So if you have any questions, and I know we're trying to run through this because there's a lot of information that's being given out today amongst health plans. Certainly, if you have follow-up questions and information that you're wanting to know more about, you can send a message to myself or Mary Ferber. Thanks so much. Have a great day, everybody.
Thank you so much, Mary and Allison. And now we will turn it to Excellus Blue Cross Blue Shield and Sarah. Provider Relations Representative. I think I have audio now. We are excited to present here today. My name is Sarah Newsom. I am a Behavioral Health Provider Relations Representative with Excellus. And on our next slide, we're going to talk about who our BHPR reps are. As you see, we have all of our reps identified on this slide. Our manager, Jennifer DeMars, she is located in the CNY area. If you ever need to contact her, her contact information is on the slide, and that's her direct number and direct email address. And then we have Michelle Scott, and Michelle covers the Rochester region. We have the counties identified on the slide, and she really focuses on those solo and group providers, as well as the OMH and OASIS licensed facilities. Then we have Brian Federley and his coverage area, as well as the specialties that he covers. And then my information is identified right on the bottom. So if you ever need to get in contact with us, that is our direct information, as well as our direct phone numbers. On the next slide, we're going to talk about communicating with Excellus and what that looks like. If you ever have questions and don't know kind of who to go to at the health plan, we wanted to identify who would be your key contacts for Excellus. If you need to update information in your provider contract, If you need to kind of be directed as to where the demographic change form is on the website and or obtain a copy of that form, you can outreach to our Behavioral Health Network Development Manager, Don Hassett, and his direct information is identified on the slide there as well. If you're having any trending claims related issues or denials, or you have questions related to remittances, or just overall questions on navigating the website, who to contact internally, we encourage you to outreach to one of your behavioral health provider relations reps, and we can help assist you with that. We'll also take time to set up a meeting and walk through any of those claim denials with you. If you have a critical incident report that you need to report to the health plan, we have the information on that third bullet there as well. If you are experiencing gaps in member care or barriers, so whether that be potential wait lists, and we're going to get into that a little bit more, and maybe you're working with a member and you identify that there's just additional supports that are needed, you can outreach to our internal case management team. And on this slide, I have our manager of case management, and her information is identified on the slide here. And then any general questions, please feel free to reach out to our member services department, and their information is on the last bullet as well. We're going to talk about access and availability standards on the next slide and kind of what that looks like as far as wait lists. So we have just outlined high level what those access and availability standards are. We do have tip sheets on our website, and you can see the hyperlink on the slide. And that will take you to where those tip sheets are. It will outline access and availability standards for children's behavioral health standards as well as adults, physical health if you would like to look at that. But if you are experiencing a wait list, we would like you to notify our health plan. You can let our case management team know, and we want to be able to document that information. That way we can work back with your agency. And if there are members who are on the wait list, then we can kind of coordinate to see, is there another provider who does have availability? On the next slide, we're going to talk about our case management team. Internally at Excellus, just like all of the health plans have described their wonderful case management teams, we do have a team that works closely with providers. So if you have a member who is experiencing gaps in care or even barriers to their care, whether that be maybe they're trying to get into a doctor's appointment, they're trying to see their behavioral health provider, HCBS provider, maybe they even have some social determinant type barriers that they're experiencing as well. We encourage you to outreach to our internal case management team, and we really look at these individuals holistically. So we will work with both the medical side of the house as well as the behavioral health side of the house to really make sure that these individuals are receiving all of the necessary care. We do have some phone numbers as well as additional information on this slide. That way, if you are just kind of wondering about the case management program and would like additional information, please feel free. You can use that information. You can always reach out to myself or Brian Federley, and we would be happy to provide additional information to you and your team. Lastly, we have our contact list, and this is the same information that you would find on the MCTAC plan matrix, which is a wonderful tool, but we wanted to identify it here as well. That way, if you are looking to kind of get in contact with a key individual, all of that information is identified on this slide, but we do encourage that if you are having difficulty connecting with someone, if you are looking for additional information, please outreach to your behavioral health provider relations rep. We would be happy to connect you to that key contact internally, and or set up a meeting and include our internal staff. That way we can kind of discuss what's going on. Thank you so much for having me today.
Thank you so much, Sarah.
And now we will turn to United Healthcare and Alana.
Hi, everyone. Good afternoon. My name is Ilana Adler, and I am the government liaison for New York for United Healthcare. I want to start by thanking you for bringing this issue to MCTAC's attention so they could in turn convene us here today. You know, we're all stakeholders in addressing this issue, and despite coming at it from different lenses, we want the same thing: for information to flow more easily between the provider and the health plan. And all of us on this panel also have health insurance, and we have to navigate challenging phone and email systems that can be frustrating, to say the least. So we all volunteer to be part of this discussion because we absolutely know what it's like to be on the other side and just want to reach a live person or hear back from someone. So just a quick comment to say we get it and we want to be part of the solution today and moving forward. So with that, we'll jump right into my presentation. Next slide. Oh, this slide, perfect. Our members really at the center of the work that we do on the Medicaid managed care side, from provider relations to behavioral health and physical health, our quality management initiatives and utilization management as well. What you might not know is that there are clinicians staffing almost all of those areas, including LCSWs and LMHCs, and people with extensive inpatient and outpatient BH experience helping to manage the members' care and work with our network providers. Next slide. So who does what at United Healthcare? All the managed care organizations work a little differently, so I think that this conversation is a great opportunity for us on this panel to explain some of the nuances. So for us, our provider relations team really can work with you on any contract related questions or issues like adding or removing a service, updating contact information, changing an address or adding a location, changing the regions that you serve, hours of operations, the addition of telehealth, any kind of, as well as being able to handle any claims related questions or concerns. And I think that we're unique in the fact that we've identified two really special resources. One is for escalated claims issues. Our contact is Heidi Hopkins, and she's your claims liaison. She is really an expert in helping to communicate claims, concerns, issues, and work to resolve them. Additionally, we have a network trainer, Gail Parker-Wright. Hopefully some of you have been on some trainings that she's facilitated for us. And if you would like to request UHC training for your agency, for your organization, whether it be around claims and billing, or whether it be around some of our portals, including our prior authorization and notification, our PAN portal, Gail Parker-Wright can schedule that for you and make sure that you get the UHC specific education that will help you guys work better with our managed care. In terms of utilization management, that team is really there to contact for any services that require prior notification or prior authorization. If you're an in-network provider, you can submit that through electronic. Our prior authorization and notification, our PAN system, that could be accessed through uhcprovider.com/PAN or through our phone. If you're an out-of-network provider, just a reminder that all services require prior authorization if you're out of network, and so you would call UHC to initiate a single case agreement to ensure that there's no interruption to your claims payment. Our quality department could coordinate with you around reporting sentinel events. You know, what we realize is that a lot of you report that through the NYMER system, through other systems, the state systems, but you're also able to report that into us as managed care, and that's the information right there, how to do it, as well as a pathway to help you find our reporting form on our Provider Express. Now, BH case management, I know that that has been a topic of conversation. UHC may provide BH case management services for members not enrolled in health homes or in ACT services. and a UHC licensed behavioral health case manager provides telephonic support and can meet with the member family in the community as appropriate to provide advocacy and support. And we just want you guys to note that in-person visits right now are suspended due to COVID protocol. So right now, our BH case management support is offered just through the telephone. And then government liaison, that's the group that I sit with. We're here if you want to discuss some innovative projects and collaborative initiatives, or any other issues not identified as covered by other functional areas above, as well as we want to be a resource for you for escalated issues. And we'll talk about that a little bit more in future slides. Next slide. So similar to what you're going to see on the MCO plan matrix on the MCTAC website, and that's the email address right there, the website right there is an additional plug. We cover things based on the regions, and this is just a visual representation of the coverage. But Caitlin, if you could go to the next slide, we really go into detail of our our network managers' name, their contact information, the areas that they cover, the territories that they cover, and the types of providers that they work with. We do recommend that you use the email addresses first. As we all know, email is easier for everyone, and it also creates a paper trail, right? So that you can know exactly when you outreached and when you heard back from them. It's just a better way for us all to communicate. We do think that it's reasonable to expect that a network manager will respond to an email or a voicemail within 24 to 48 hours. And we ask that same from you guys when we reach out to you as follow-up, or if we have a question, that you also respond to us in 24 to 48 hours. Again, you don't have to take screenshots or furiously write any of this down. This is all on the MCTAC plan matrix, but it also will be available. MCTAC will send this out and it will be posted. So all this information will be available to you. The last thing I just want to point out on the slide on the bottom is that we do provide you a general network management email box. In case you are having any kind of difficulties reaching any of the direct contacts who cover the territory where your offices are located. Next slide. And this is my last slide. These are some, at UHC, we have a lot of online resources, a lot, but these are just two I wanted to highlight for us today. The first is uhcprovider.com. That's where you can check member eligibility, check claim status and payment, claims reconsideration, the EDI information is there. Link to Rally, that is our provider directory, can be accessed through uhcprovider.com. That's really important because Medicaid does not have an out-of-network benefit. You need to go to an in-network provider. And so knowing who's in network in your area is really essential. So please use this resource. And on uhcprovider.com, there are additional tools and resources. And then we have Provider Express. That's really for you guys. We have a New York page where you can access Medicaid provider resources for adults and children under 21, including a special section for our 29I healthcare facility VFCAs, a special sub-tab that has resources specifically for that cohort of providers. Under adults, children, and the 29I VFCA resources, we do have quick reference guides that are chock full of information. They're 2 or 3 pages, have a ton of information that is really specific. Again, our clinical guidelines and policies are on providerexpress.com. Our prior authorization and notification PAN behavioral health guide, how to submit prior authorization and notification, how to access, how to navigate that system is all on there, as well as training and resources, including how to go through the PAN system. And finally, our Sentinel events reporting form is on our Provider Express. So that was the end of my presentation. Caitlin, Boris, I'll pass it back on to you guys.
Thank you so much, Alana. And now I will pass it over to Boris, who's going to moderate our Q&A session with the panel.
Excellent, thank you. And thank you for all the plans and their presentation and information that they have provided. For the last half an hour or so that we have left, we really want to focus on three sections. They're all questions related. So we have some common questions that we get a lot. And so we want have an opportunity for plans to answer those questions. I also want to say thank you for individuals who have submitted questions in advance of this presentation and responded to our survey. So we have some questions there that we're going to go to as well. And then of course we'll turn to the questions that we're getting through the chat. And again, want to encourage folks to continue to submit those questions in the chat to have the opportunity to speak with the managed care folks. So in just being mindful of time, and I think each plan really went into detail about, describing the difference between care management, contract or provider relations and government relations. And if we have time, maybe we'll come back to that. But I think I'm going to jump right to question number 2 in regards to the kind of the creative solution suggestions that our panelists today can provide for our providers to implement, when they troubleshoot member access issues or barriers or other things, right? So anything that folks can advise providers into how to navigate or troubleshoot, especially around maybe member access issues. So let's see, I'll probably just go around and ask folks to speak. So maybe we'll start with Mary, if you can have some ideas or suggestions on that question.
Sure. So I guess, I'm thinking of different situations that we've had in the past related to providers who've reached out to us on access to care issues. And usually it relates to, being able to find a provider that's able to take an appointment. Or if there is sort of a need to find a service for a particular member and just wondering who's the best provider to go to. So I'd say for behavioral health, we certainly want to reach out to, our Allison West's team. We have a sort of like a care navigator who's an individual who dives into the specific case, gathers the details, and then really does a canvassing of the area to figure out where we can get that member into care. So reach out to us so we can help, because that's what we're there for, and can be, an additional resource just to ensure that we can make that appointment happen. So that's one example.
Excellent, thank you, Mary.
You're welcome.
Cheryl, let's go to you next.
Sure, thank you, Boris. So along the same lines as what Mary was talking about, it's difficult for us to know and identify an issue that we don't know exists. So if your practice is full, or if you are finding it difficult to find services for your clients or for the patients, we would like to know that. So if you're not accepting patients for certain modalities, et cetera, if you can't find services for patients who need them, that helps us identify trends in an increased need for certain services or those services in a particular area. So that would lead us to monitor our network on a larger scale. And if we don't have that communication with you, we may not be aware that there is a problem regarding a need for additional providers for that service in a particular area or the service in general. And also very, very important is if you do have availability, please let us know what your availability is and for which modalities you have that availability, so that we can spread that information around and hopefully get some referrals out to you guys.
Excellent, thank you for that.
You're welcome.
Ilana, we'll go to you next.
Yeah, oh my gosh, Cheryl said it exactly right. If we don't always know that there's a problem. Oftentimes, as part of my role, I attend regional planning consortiums, the RPC, and I will hear what's being said at the meetings in terms of the access and return to our network and our case management team and say, This is what I'm hearing out there in the provider world. And they'll say, we're not hearing this. This information is not getting back to us. And so we definitely encourage, our providers that if you guys are experiencing access issues, wait lists, to come to us with information. I not anecdotal, but with specific information like this. We've tried to get our client into this provider. They are telling us there's a 1 month wait list. That's very specific information that we could follow up on. And we could also, as Cheryl said, canvas the area and figure out like what are our network needs? Is our network adequate in that area? Does it need expansion? An additional suggestion would be, to look at our provider directory. We often think that we know everybody who works in our county or who does a specific kind of work, but that might necessarily be true. We want to encourage everybody to make a referral to an in-network provider to avoid any potential issues. If no one in the members area is taking new referrals or there's a real barrier to accessing care, please contact your dedicated network manager. Again, that information who covers your areas on this slide deck, but also always updated in the plan matrix. And the member, him or herself, can also contact our member services line, which is on the back of their card, to request assistance to find an in-network provider accepting referrals in his or her area. Again, as Mary said, that's the legwork that we're able to do for the member if he or she calls that member line on the back and is requesting assistance.
Excellent, thank you. And Sarah, let's go to you.
Sure, awesome. So all of the plans did a fantastic job of really laying out all of the information. I think that one of the things that I kind of want to echo is if you are working with a member, we know each individual is unique. And if you're working with a specific member and you really are looking for additional solutions, or there is a situation that might be trending with some of the individuals you're working with, please outreach to our internal case management team. If you can't get a hold of them, please outreach to me. They have in the past met with providers and done a lot of kind of troubleshooting, talking about what's happening and how can we assist. Also being able to kind of brainstorm. I know we'll take CFTSS, for example. We've had a lot of providers who have said, I'm not getting the LPHA form back for that diagnosis, and how can I connect an individual to services? So sometimes if the provider doesn't have an OLP on staff or they're not facilitating that service, we've been able to connect those providers with other agencies who have OLP. So we really want to be able to work with the provider and ensure that our members are receiving all of the care.
Excellent, thank you. So what I'm hearing is communication is key, right? Making sure folks communicating with you directly, letting you know. And the other, I think, important takeaway here is you guys can also help, right, in regards to many different scenarios, and especially in instances where somebody is looking for services for their consumer, their client, their patient, and so forth, and having hard time, and they can call you guys, not you necessarily specifically, but meaning the plan, to get some of that assistance in that respect. And of course, that also then provides information to you. So really appreciate that feedback. So going to the other question, of course, we especially now get a lot, is, are there any expectations that plans have in regard to telehealth versus in person? I know Cheryl touched a little bit about kind of some of the beacon rules, but just wanted to open up to others. And Sarah, I think we'll just pick it up with you again, and if you can talk a little bit about Excellus.
Sure, yeah. So Excellus, just like all of the other health plans, we follow the New York State rules and the guidances that are set out. We do encourage providers to really identify what is the best method for that individual that they're rendering services to. So maybe the specific individual really needs telehealth services and they can't be in person at the time. So really making sure that you're looking at what's best for the individual. We do want to make sure that providers are utilizing HIPAA compliant technology. If you do have questions regarding what is that HIPAA compliant technology, maybe there's questions regarding reimbursement, always feel free to reach out to your provider relations representative, and we would be happy to schedule a meeting and walk through everything with you.
Excellent, thank you. Ilana, maybe we can go to you next.
Sure. I think just to echo what was said, for Medicaid products, we all have to follow state guidance. There's really no flexibilities. I think that that was one of the biggest shocks to me when 5 years ago I transitioned from being a community-based provider to working on the managed care side. So to be clear, any decisions related to reimbursing for telehealth, acceptable modalities, which platforms will be acceptable, is under the guidance of the state. So right now we're all operating under the commissioner's extension as the O offices work to enact permanent regulation. So I hope you all joined MCTAC's series of discussions on this exact issue just a few weeks ago. Boris, I think that they were recorded, right? So if people couldn't attend, I definitely encourage you to go to MCTAC's website and listen to it so you could hear what OMH and OASIS said directly, not word of mouth. You can hear what they said. What things will look like under quote unquote steady state is really still up in the air. And while the state has made comments and some assurances, until we all see the written guidance, we can't truly know what's going to be. So we're all waiting with bated breath for state guidance to be official.
Excellent, thank you. And Mary, maybe we'll go to you next.
Thank you, Boris. So, you know, I guess we're going to sound sort of repeating here, but, you know, to add additional information, I guess I'd agree with Ilana that session that was held related to telehealth and sort of the status and where we're at and where we're going to see, it's an excellent session. So I would also encourage you to go listen to that. And one of the areas of that overview I found super helpful was the Q&A, because there were a ton of questions and they were really great questions. And it touched on a lot of sort of specific example types of issues so that you find that really helpful. One other thing that I sort of also gathered from that session is that if an individual patient or client would like to come into the office to be seen, the provider needs to accommodate that. And so we just need to know that, you know, we know that specific practices have their protocols for safety, promoting safety, ensuring that the individual patient is safe or client, and that their staff is safe, and that would be expected. But we shouldn't have anybody telling a client that they can't be seen. And so I think that that's just, you know, important to add to the other information that was conveyed here today. So thank you.
Yep, thank you. And Cheryl?
Thank you so much. So I know everybody, Alana, Sarah, Mary gave tons of information on, you know, Medicaid guidance is Medicaid guidance. That's what it is, you know, and we all have to abide by it. But I did want to say, you know, with expectations regarding telehealth versus inpatient, and again, it is, you know, member driven, but of course, providers put their you know, whether there's face mask required, social distancing, et cetera, but providers should always be available for in person if it's deemed to be medically necessary. And also, just to let you know that telehealth itself does not make a service require authorization. So if the base service is just, you know, an outpatient office visit, rendering that service via telehealth does not then make it require authorization. However, if the base service is like, you know, partial hospital or ACT or PROS or something like that, where that particular service would require authorization, it would still require authorization under telehealth. But telehealth itself doesn't make something require authorization. So again, you know, what's clinically best, what's medically necessary, you know, how a provider determines with their patient whether or not a service should be rendered telehealth or in person. That's totally up to you guys. And then I did also just want to add one thing about notification and communication with the plans, especially Beacon, that we really, really appreciate providers contacting us to let us know if there's a change in your office hours or a change in your status of whether your practice is full or not. We do have lots of members and providers who access our website to get a list of providers that they can refer members to or that they can contact for services. And oftentimes the members will contact us back and say, I contacted this list of providers and no one was available to see me. So then we call the provider and we say, you know, one of our members called and said they tried to contact you. You're listed as accepting new patients, but this patient advised that you told them that you were not accepting new patients. And that's when you tell us that your practice is full. So we would really, really encourage you to communicate your information with us if there's any change in status at all with your practice, whether it's your office hours, whether you have new availability nights and weekends, or whether your practice is full or full for certain modalities, et cetera. So just keep the communication coming.
Excellent. Thank you for that. So as we talk about communication and the importance of it, one of the questions we've gotten, I think it was from the chat, but also in the survey we did, is in regards what should providers expect if there's any policy in regards how fast you guys respond, right? So I think somebody talked about 24 hours, I think, hopefully I'm not making it up, that they will get a response. But is there a general, you know, rule of thumb? So if I email somebody or call and leave a voicemail, because either I'm trying to communicate about my access issues, or I have questions, what's the return back to me as a provider and how quickly? So I'm going to just open it up, see if folks don't speak all at the same time and see if that works. But if anybody wants to jump in and, you know, provide some information on that. Right, so we have the reverse side. Nobody's jumping in.
I'll speak. It's Ilana
Trying to
from United
unmute.
Healthcare. I think for United Healthcare, a reasonable expectation is 24 to 48 hours, but we're all people and things happen and people forget to put out of office, responses, and people missed emails or voicemails. Things happen. I think it's a reasonable expectation, but we should all be kind to each other. But there also, again, if there needs to be an escalation of issues, if you feel like you've reached out a few times, 2 or 3 times, and heard nothing, we at the government relations team can act as an additional resource. Our information is on the plan matrix, on this slide, so on the slide deck. So you could definitely reach out to us if you're having issue finding connecting with somebody on the network management team.
Excellent.
Of course, this is Sarah from Excellus. I would echo the same thing as Alana. So we usually will get back to someone within 24 to 48 hours. There are those circumstances that Alana illuminated. If you aren't able to connect with someone, you can contact Jennifer DeMars, our manager of behavioral health provider relations.
Excellent.
And this is Cheryl from Beacon. Sorry.
Go ahead, Cheryl.
Thanks, Mary. So for us, the same thing. I can't say 24 to 48 hours. I would say 48 hours, and we would make sure that we have a response back to you. A lot of providers will send me an email directly. And again, usually I try to get to them as fast as I can to get everything off of my plate as quickly as possible. But you know, again, it's within 48 hours. But if I happen to be on vacation and you get my out of office message, then I will respond to you as soon as I get back. But the best idea is when you're sending me an email, if I'm out of office, send it back to me the day I come back. So it's at the top of my pile. So just a little Just a little hint for you guys.
And this is Mary. So I'll just echo sort of the time frames. Our policy is 2 business days. And I'll have to say that in reading the questions that came in from folks and saying that they didn't hear back from their representative ever, it took 2 to 3 weeks. There were other comments that were similar to just a true lack of communication, and that's disturbing to hear that, to say the least. I know that folks get really busy. I know that I get really busy. I try to stay at the gold standard, and sometimes when you're completely buried day to day, and I think we all know what that feels like, it might take a little bit longer. But again, I think that, you know, I want to ensure that folks feel that they have someone that they can call. Obviously, on our plan overview, there was one name on there, and it was my name. You can call Allison as well. But I think that, you know, we're just a smaller plan, and, you know, we're not across the entire state. So you know that you can always call our provider service line. Even if it's a complex escalated issue, still call them. If you feel that you're not getting a response from me, they're going to come through and they're going to send me through. We have an internal kind of ping system. They're going to let me know. And so we have that. Also, my director for network management is Joseph Smith. That's joseph.smith@amerigroup.com, so that you can always get in touch with my director if you feel that you're not satisfied with the service that you're being provided. Also, I'll make mention too that most health plans do send out a provider satisfaction survey. And that is really the time to express any kinds of thank yous or concerns that you have, particular to timing. And so we really want to hear how well we're performing. You know, from grade school days, we all got a report card, and that can be a very uncomfortable time. If you're getting A's all the time, that's great. Sometimes people fall a little bit below that. But it does help us evaluate sort of workload, whether there's enough staffing. And it does help management sort of try to understand what the service needs are, the volume of those, and make sure that the plan is appropriately staffed, because each individual person, human, we can do what we can do. We try to do the best that we can. But you get stretched too thin, and that's when things aren't good. So fill those surveys out. I know for our plan, the survey is going to be coming out soon, so I'm making a plug for it, but I'm sure the other plans will as well. So thanks, Boris.
Excellent, thank you. All right, so the next question is, of course, for all of the plans, but maybe even for Caitlin. I know Caitlin's like, what? A question for me? So the question that came in, you know, we talked about, and especially Caitlin in the beginning, talked about kind of the state requirements of access of, you know, if it's urgent and emergent, routine, and so forth. And so she ran down those slides. And the question is specific to CFTSS and children's HCBS. Because I don't think they were specifically called out in those slides. And so I guess the question is, do the same standards apply? Meaning, you know, within 24 hours for urgent, and of course emergent, you know, immediately, and the week and so forth. And I don't know if Caitlin, if you can bring up those slides again, just to review. But I guess, does anybody have a sense of specifically for CFTSS and children HCBS? And if not, we might need to get back to you know, the group and the person who was asking the question. But
Boris, this is Sarah. So on our website, in our tip sheets, we do have, and I can send it to Caitlin as well, but we do have the standards for CFTSS within that document. And that comes right from the New York State plan standards that all health plans followed when implementing. So that might be a helpful resource to reference.
excellent, thank you for that. Yeah, yeah. Anybody else? I don't know if anybody else has additional information. My suspicion is it would follow these particular rules. but we can follow up on that if needed. And another question that we got actually through the survey, and again, realizing that as a plan, you might not know all of this, but in instances where you might know and situations, because we know when there's wait list, sometimes the individual might be on wait list with multiple providers for exactly the same service, right? To kind of just to increase their chances in getting into service sooner rather than later if multiple providers having a hard time with access at a particular moment. When that happens and you are aware of it, I guess the question was how much your care managers or others might communicate with providers, especially if somebody does get in and actually is offered an appointment and starts seeing somebody in one provider, but might still be actually on the wait list with another. And again, kind of back to that communication and coordination piece. And the question was, do you guys actually then reach out to the other providers and say, hey, this person is already in the service, take them off the wait list and so forth? Again, acknowledging that you might not know that all the time, but when you do, is that something that care managers would do or others maybe at each plan? Hopefully that made sense.
Or this is Sarah from Excellus again. So I did pulse back with our care management team regarding this question prior, and they did say that if, so say for example, like HCBS, say there's CES involved, we will pulse back with the CES coordinator just to identify kind of where that referral is at, if they did send out additional referrals, and ensure that the individual is receiving services. If there's a health home care manager involved, we'll do the same type of coordination. If there is not CS or a health home care manager involved, so say for example, CFTSS, and the individual doesn't have care management through a health home, we will work back with the family to make sure that there is communication, and we will communicate back to the providers.
Got it. Thank you. Other folks? I don't know if others have anything to add.
Hey, Boris, it's Allison West. I'll weigh in on this for the Blue Cross Blue Shield Health Plan. Yes, our case manager team would be assigned to monitor, track, and follow up on requests such as this. And they would work in tandem with Mary Ferber to let her know too. But they would be the ones to follow up with the provider and the member at the same time. And they typically, as they're monitoring, will outreach weekly if it's a more urgent request, or bi-weekly if it's something they're just kind of tracking and waiting on.
Got it. Thank you. And as we talk about wait list, we got another question in regards to kind of the case managers and care managers' responsibilities. I guess this question was, do case managers staff help triage wait lists and I guess work with providers in maybe identifying clearly for your members within your plan who might need more urgent situation and need to be seen, and because the wait lists are not always as clean cut, right? First come, first serve, because you got to take into account urgency and emergent situations as well. And is that something the care managers might help think through or work through that process?
Yeah, and so this is Cheryl
ahead.
from Beacon. Sorry. So for Beacon, I know that our care coordinators will work with providers in helping to triage, and maybe even not necessarily triage, but if the provider is telling us that it's an urgent need, then our care coordinators will certainly work with providers that for a referral, and let them know that it's an urgent or emergent referral. And then once they get an appointment, then of course they would work backwards and let the providers who put them on a wait list know that they've actually gotten that appointment. So 2 birds, 1 stone there.
Gotcha. Thank you. Others?
Boris, this is Sarah from Excellus. So we will work with that individual, the family, if needed, and we will ensure that they are connected to services. We'll also have meetings and work with the interdisciplinary team to identify, is it an urgent appointment? And if there are providers in the area that do not have a wait list, and connect that individual to those services.
Excellent. Thank you for that. All right, just being mindful of time, we have a couple of minutes left. And Caitlin, I think we have a couple of more slides. I just wanted to, make sure that we share and make sure folks know that this will be coming in the slide deck. I think we had a contact list.
Yes, I will share the slides back again, but we do have contacts for each of our panelists. Again, there's contacts that are also in the matrix, but you can see it. Let's quickly go back to that. Okay, so here we go. Here are our panelist contact information. You can see the email for each of them. Again, there's also the matrix that has all the information as well. And then our final slide is just to remind everyone of the updated CTAC MCTAC website. You can still find it at ctacny.org. But we just wanted to remind providers in case you've noticed any changes. It's still our same URL, but if you have any questions, you can always send us an email to our help desk at ctac.info or mctac.info at nyc.ctc.
Excellent, thank you. And so I think, just being mindful of time again, I want to thank all of our panelists and the plans for participating and answering questions and providing the information. Really appreciate it. And for all of our participants joining us for today's discussion. I hope folks found this helpful. And again, the slides and recording will be made available probably sometime next week. But just want to say thank you again to everybody and have a great rest of your day. Thank you, everybody. Take care.
Take care.